Welcome to another edition of This is Public Health, a podcast from the Illinois Department of Public Health. 1 year ago, IDPH delivered to the Illinois General Assembly a 5-year plan for addressing the most critical public health needs in the state. The Healthy Illinois 2028 plan focused on 5 major areas. Over this past year, IDPH has been developing the plans and strategies to achieve the goals laid out in Healthy Illinois 2028. 1 year into that 5-year plan, it's time for an update on that progress. We begin with the director of the Illinois Department of Public Health, Dr. Samir Vora. Director, thanks for being here. I want to ask you, why is it important to have this kind of long-term plan that identifies and lays out these sorts of key priorities?
Well, Jim, thank you for having me. And what we hope that the listeners of the This is Public Health podcast will hear is the innovative things that are happening all across the state of Illinois as we march to a Healthy Illinois 2028. Over this podcast and the subsequent next 5 podcasts, we will dive deep into the state health improvement plan and our goals with Healthy Illinois 2028. We'll tell you how we got to this plan, the process, the hard work, the community engagement, and then dive deep into topics of chronic disease, emerging illnesses, maternal and infant health, mental health and substance use disorder, and racism as a public health crisis. Both telling you the challenges that we face throughout the state, the goals that we are marching towards, but in that process, the innovative community leaders in every corner of Illinois that are working to make impact across these 5 categories and across the overall health of our great state.
Dr. Samir Vora, Director of the Illinois Department of Public Health, thanks for getting us started in this important conversation about the State Health Improvement Plan. Now let's delve a little more deeply into how IDPH is working to address these 5 key priority areas and the process it's using to do that. For that, we'll be turning to our guest, Jenny Epstein, Deputy Director at IDPH, overseeing the Office of Policy, Planning, and Statistics, and Karen Phelan, the Chairman of the State Board of Health here in Illinois. Thank you both for being here. Jenny, let's start with you. Give us an overview of this past year since Healthy Illinois 2028 was initially delivered to the General Assembly and the steps that you've been overseeing to turn this 5-year plan from a plan on paper into a working reality.
Hi, Jim. Thanks for having us on the podcast. It's great to talk about this plan. We've been working hard, and honestly, a lot of it's been across the state with our public health partners, from local health departments, community-based organizations, medical providers, associations. Everyone has been hard at work this year. So the implementation of the State Health Improvement Plan, or Healthy Illinois 2028, launched on January 1st of 2024. And, like the director said, the goals, objectives, and strategies outlined in Healthy Illinois 2028 are focused on improving the health and well-being of all individuals to provide everyone with a fair and equal opportunity to obtain their highest level of health. And that is the core of health equity. And that is fundamental to the State Health Improvement Plan. It's the principle that all people have a fair and equal opportunity to be as healthy as possible, regardless of their circumstances. And that's what we've been focusing on this year with implementation. We've been focusing on celebrating the public health wins in Illinois that move us towards achieving this healthier and more equitable state by 2028. And that's across the 5 priority areas and those cross-cutting issues of social and structural determinants of health and public health infrastructure. So this year, IDPH worked with the University of Illinois Chicago Institute for Healthcare Delivery and Design and the Illinois Public Health Institute to assist with completing a wins and gaps assessment to track the progress of statewide efforts towards those SHIP objectives. The assessment combined survey data and interview data from public health stakeholders across Illinois in the second half of 2024. And the primary goal is to collect data on public health achievements that align with Healthy Illinois 2028 strategies, and also to help us guide the work in the future. Where should it be focused? Where do we need to direct our efforts? And this gathering of data resulted in the collection of hundreds of examples of public health wins in Illinois. So the next step is to celebrate the wins, right? Talk about them, get those organizations' names out there, celebrate what's going on. And then the next step, which we're moving into, is to identify some gaps and what's going to determine our direction for 2025. In 2025, we're going to operationalize action teams. So we call them the State Health Improvement Plan Action Team. Each team is focused on implementing strategies in one of those 5 SHIP priority areas. So chronic disease, maternal and infant health, mental health and substance use disorder, um, racism as a public health crisis, and emerging diseases. The action teams will review and prioritize gaps and make recommendations, develop implementation and evaluation plans, which is central to public health, ensuring that we're constantly evaluating what we're doing to address any gaps, implementing plans, engaging community and stakeholders, and then tracking and reporting out to the public. And that's kind of what we started doing this year, and we're going to continue on into 2025.
We'll delve a little bit more into that process of reporting back to the public in just a moment. But you mentioned public health stakeholders, partners in this process. That's a big word at IDPH, partnership. So talk a little bit about the partners that you're working with. What role do they play in assessing the progress we've made so far and in implementing the plan going forward?
Partnership is key to every single thing that we do. Public health is an approach that is both comprehensive and rooted in collaboration. When we talk about, for example, social determinants of health, we're talking about where you live, work, and play, and how that interacts with health. And so we have to have a diverse group of partners in order to achieve our goals and objectives outlined in the State Health Improvement Plan. And partnership is so important that it's actually in the name of the group that leads this effort. So the SHA-SHIP partnership is a mandated mandated board that is facilitated by the Illinois Department of Public Health. It's multi-sector, and it's appointed by the director of the Illinois Department of Public Health in collaboration with the governor's office. And that group includes state agencies, so Department of Human Services, Department of Insurance, Department of Children and Family Services, just to name a few. It also includes organizations that, as I mentioned before, deal with those social structural determinants of health. So organizations that deal with food security, transportation, childcare issues, all those things that impact our ability, again, to access care and to live our healthiest lives. That partnership really leads and drives the effort. So starting in about 2022, we worked with that partnership to pull together this new state health improvement plan. That group oversees our efforts and also reports to the State Board of Health. So we'll be hearing from Karen Phelan a little bit, and as well at the final report and then annual report. So those are the drivers of the plan. But we have to have people that are doing the work and are providing recommendations. And so that comes from our subject matter experts, our community partners, and other stakeholders. We want to make sure that the people are at the table that are doing the work and that have the expertise in the work. So those are the groups we worked with when establishing, and finalizing the objectives, looking at the feasibility of strategy implementation. As I said before, these are medical associations, medical providers, community-based organizations, groups that are focused on social determinants of health. And then we have our planning partners. IDPH can't do this alone. So we work with the Institute for Healthcare Delivery and Design and the Illinois Public Health Institute on the State Health Improvement Plan implementation. And I would be remiss to say the partners we have within the Illinois Department of Public Health. This plan is the state's plan. It's the state public health plan. However, so much of our data comes from the Illinois Department of Public Health. And a lot of and we also have a lot of staff that are working on this and supporting this effort. So really partnership across the board and true collaboration. It's really I like to call it a collaborative space for public health. It provides a guide for us as we move forward through the next 5 years, and a space that we can a course we can chart together. row in the same direction.
We're talking with Jenny Epstein, IDPH Deputy Director in the Office of Policy, Planning, and Statistics about the State Health Improvement Plan. One of the big things on the horizon in 2025 is the implementation of a dashboard. You talked about reporting out to the public about the progress that's being made, and this will allow the public to view these Healthy Illinois priorities and how they're being addressed one initiative at a time. So tell us about that project and what we can expect going forward.
Yeah, so this is really exciting. I don't have a ton to share right now, but the data that we've been collecting or collected through that wins and gaps assessment I mentioned earlier is helping us populate what will be a public-facing dashboard. And the dashboard is created in collaboration with our partners at the at the Institute for Healthcare Delivery and Design. Is going to be an interactive tool that breaks down the progress and accomplishment by the priority areas and goals. It will feature success stories across Illinois. Again, just charting our progress per objective, and then we're also going to provide some of those public health resources that have been created by other organizations and state agencies. We do a lot of planning at the state level, and there's a lot of really important, really comprehensive plans that address some of our most challenging and sticky public health issues. And we're going to have those available. Our goal is to have those available on the dashboard as well for the public to have access to.
We'll be looking forward to seeing more about that in the months ahead. We now want to welcome Karen Phelan, chairman of the Illinois State Board of Health. The board convened a series of hearings in the fall of 2023 to hear from experts and the general public about critical public health issues. That was a key component in determining the major priority areas in the State Health Improvement Plan. Chairman Phelan, thanks again for being here. Let's talk first about who makes up the State Board of Health and the role you play overall in supporting public health in Illinois.
Thank you so much. I'm so happy to be joining you all today. The Illinois State Board of Health has evolved over the years and was many, many years ago a very powerful group of people in the healthcare industry making all decisions for the department. However, much before my time, as I was appointed to the State Board of Health during the Edgar administration, it gained momentum as an advisory board to the director and the assistant director. We are a serious working board. Our bylaws confirm 20 positions appointed by the governor and Senate approved, representatives of specific areas of expertise, professionals, several licensed physicians, some in areas such as medical school facility, certified in preventative medicine, engaged in private practice, registered nurse, public health administrators, citizens at large, a dentist, business community reps, chiropractic physician, optometrist, veterinarian, physical therapist, and more. And if I don't take a moment here, I'd be remiss, as I'm proud to report that we are fortunate to have the knowledge and support on our current board of a former IDPH director. And probably this is where I should also mention that the quality of expertise we have had on this board over the years has indeed been recognized, as two of our current IDPH executives, our director and our assistant director, served on the Illinois State Board of Health. Our terms are 2 or 3 years based on whether they're filling the remainder of term. There are no term limits. I always emphasize we are a working board, meeting 8 times per year, and based on need, our board will immediately convene at the request of the director, the assistant director, or the chair to address an urgent situation or a timely concern. And we have called special meetings on many occasions. Obviously, before joining the State Board of Health, our board members are already focused on supporting public health, addressing inequalities, seeking to find better solutions for those in need of some support, perhaps maybe access to care. State Board of Health members, view situations through a specific lens to be inclusive of all residents, regardless of which county one resides. Again, we are an advisory board offering expert insights based on knowledge and experience. We offer suggestions, weigh in on situations, and always compromise with the department on issues of importance to the people of Illinois. As a team, yes, we are strong with diverse input and foresight, and our combined efforts are important to make every decision. As the State Board of Health must stay involved and remain informed, our members are asked to be part of task forces and work groups, advisory councils, And we create ad hoc committees to research projects, always bringing all information back to the board for awareness and input. Our board truly is comprised of dynamic leaders with incredible resources, vast partnerships, as Jenny mentioned, and networking ability. Some of our board members are public health officials. Some are the most respected individuals in our state, but all of our members have something to say, something to offer, absolutely something valuable to bring to the table. In 2024, we were tasked with 4 topics to research: climate change's effect on public health, communications, rebranding public health, health equity zones, accountable care in communities, and public health data modernization. Our board members collaborated with IDPH staff and all public health partners to report on the status of these issues and to propose innovative solutions as we reviewed each situation, remembering the goal of creating the brightest of futures for the people of Illinois. As our board members represent all areas around our state, they are excellent ambassadors, incredibly familiar with their territory, able to appropriately convey the correct and honest message out to the people, as sometimes our immediate impact on the community is vital. Our board members are truly dedicated, they're diligent, they are determined to be productive, and we respect each other as we all work within the guidelines of our very specific bylaws. And we are required to complete 6 yearly training programs provided by the state. The State Board of Health is supported by government liaisons within the department, and we're grateful for their administrative attention to detail. The State Board of Health has handled many routine issues as well as major controversial issues over the years: varicella vaccine, raw milk, tobacco, homelessness, food safety, cannabis, COVID-19, and many, many more. The State Board of Health also reviews state rules in conjunction with the rules coordinator. Changes are suggested and written according to the statutory language, and our board members oftentimes require clarification and request adjustments before being approved and forwarded to the Secretary of State for first review. And just 2 more things I need to say. The State Board of Health has a policy committee, and I always joke it is the most sought-after committee to join. Brainstorming sessions, discussing ongoing challenges and current issues are shared at this meeting, and updates and action plans are developed. All information is then presented to the State Board of Health for final approval. And lastly, we are required to present to the governor and the General Assembly a report due February 1st of our yearly activities, and we're working on it.
A lot of expertise on this board and a lot of responsibility as well with those very full plates for you and your members. Talk a bit about specifically how the State Board of Health is involved in addressing the priorities of the State Health Improvement Plan.
We normally have 2 or 3 board members on the SHIP and the SHA as it's being created. Over the years, members have been involved in the core team along with all the partnerships, and we spent years prioritizing and reviewing the challenges presented to the people of Illinois as we attempt to protect their health and their safety. We worked, as Jenny said, extensively with the 5 areas of concern, and our board members are part of those action teams, part of the subcommittees, and they get involved where possible. We worked on the SHIP as often as we can and thinking about it as we hear concerns and suggestions. And as you talked about, we did have the hearings throughout the state. We heard what was said. We made adjustments to that. Our goal is to review the specifics of the State Health Improvement Plan and to continue to use all the tools that have been researched and studied and are available to us. We continue to be part of all the surveys and all the meetings to keep abreast of the progress. It is a framework for action. We recognize we fall short in certain areas. We have prioritized where our focus should be. We are not perfect, but we work together to become a better present a better, more viable package. We respond to what we know can be improved. We listen to those around us. We obviously see what requires change. And I'll be joined by many in saying we make this effort every day to establish appropriate improvements for our residents, the people of Illinois. Let me say, as many of us know, our workforce is strong, but it could be better. We acknowledge our challenges. We look forward to opportunities to make better public health available for all. As we all know, it's mandatory. We are aware of what impacts our lives every day, and we strive to make it available to all people, all residents of Illinois.
1 year into a 5-year plan, a lot of work already being done, much more on the way. We'll continue to keep you updated on the progress of the Healthy Illinois 2028 5-year plan. In the meantime, thanks again to our guest, Jenny Epstein, Deputy Director at IDPH in the Office of Policy, Planning, and Statistics, and Karen Phelan, Chairman of the State Board of Health here in Illinois. In the weeks ahead on This is Public Health, we'll be looking more closely at each of the 5 major priority areas in the State Health Improvement Plan, starting with emerging diseases. That will be our focus on the next edition of This is Public Health with the Illinois Department of Public Health.